Welcome back to another edition of the Good Eye Podcast. I'm Jay Smack. Today, my guest is Dr. James Wright. Jim is the medical director at Canterbury Rehabilitation and Health Care Center in the Richmond area, as well as the medical director for two other elder care facilities in Richmond. But Canterbury was getting all the notice, all the recognition for all the wrong reasons early in the COVID pandemic. They were losing patients at quite an alarming rate. It was sort of ground zero for the pandemic nationally for a time, and his visibility, unfortunately for him and for his patients and Canterbury in general, rose quite a bit as he was being asked to speak to what was going on there. It was, as I mentioned, very early in the pandemic before we really understood completely what was going on and how so many of these patients were compressed into one area, and the virus started spreading like crazy, and Jim was right in the middle of it. Now, he is also working on bringing into reality a facility called Homecoming, which is an elder care and memory village where patients, residents can walk around freely and have a more engaged life. He will speak to that quite a bit today, but I do appreciate his time and insight during today's conversation. So I urge you, whether you have been touched by memory issues, impairment, yourself or family members, or have just heard about it or are curious, please do stick around and listen to Jim's insight and expertise that he shares on today's episode of the Good Eye Podcast. So now I present my conversation with Dr. Jim Wright on today's Good Eye Podcast. And I am pleased to welcome Dr. Jim Wright to the Good Eye Podcast. Dr. Wright, that's the first time I'll address you as Dr. Wright because I just know you as Jim, so I hope
you can just call me Jim. Probably easier for both of us.
Well, as I am a James as well, you can stick to J for me just to avoid confusion.
Yeah, right.
But you have had quite a journey here. Well, I'd like to talk a little bit about your journey over the last few months, but then we will focus on your vision project, which is really exciting. And for people who don't know, and why would they, my own path has brought me through an experience so far. Let's hope it remains that way only, and that I don't encounter it later in life, but you never know.
Live long enough, you never know.
I know, man. We're living so long now. But Alzheimer's disease, my mother-in-law passed from it. She had several other ailments, but I was on the front lines with her and my wife during that experience. So it is an issue and an ailment, if it can even be called that. It seems like so much more. It's so tragic, but it's
more than just a disease. Of course, it's something that affects the person, their whole identity, their relationships with others, their relationships especially with their family, their spouse, children. It removes most of what that person was before the disease. So it's unlike any other disease. It's a disease of the self, as some people call it.
Oh my. Wow. Yeah, that's pretty poignant. But your vision, and I want to come back to it, so we can lay some foundation, but it's for a memory care village.
Right.
And people might be saying, village, what do you mean by that? But let's go ahead and back up briefly and tell people, if you wouldn't mind, your path that has been going on the last few months, your position as medical director for 3 facilities around Richmond. I won't summarize it. If you wouldn't mind, just kind of give some people some background on what's been going on.
Yeah. Thanks, Jay. It started in March, about mid-March. We were really the first case in a long-term care facility in Richmond. And it quickly, at one of my facilities, Canterbury Rehab, I'm medical director there, along with 2 other facilities, like you said. But at Canterbury, it quickly ran out of control. It started with a room in our facility that was shared by 3 people, and then that wing, and then that floor, and then the entire facility within the space of 2 weeks. It outstripped our our ability to keep up with it, to isolate people. It outstripped our resources. Our staff was working 12-hour days, sometimes longer. Some people sleeping there in the facility. We had everyone pitching in to just try to keep our residents comfortable. There was, little you could do from a medical perspective other than keep people comfortable, making a decision whether or not to send them to the hospital to be on a ventilator or whether to stay at your facility and pass away from the virus. So, of course, a lot of agonizing decisions and long, long days. And we ended up, of course, doing the best we could, but in the end, coronavirus won, as it always does, and we ended up with 51 deaths in our facility in the space of about 3 weeks, maybe 4 weeks, from mid-March to mid-April. So it was the worst experience, of course, in my professional life, probably in my personal life as well, because I've been a physician there for 10 years. Many of those patients I've known as long as that. That's their home. I'm their physician, their primary care physician. They look to me usually for help and hopefully cure at least of many of their diseases. But I was, unable to do that with this. So it was, a horrible feeling of helplessness watching patients and people that you value and love pass away every day. So it's, of course, will be with me, for the rest of my life, no doubt about it.
Well, it also speaks to, and this is not an assertion by me, more of a question, but it speaks to the larger issue of how the point we've gotten to regarding how we treat our elderly.
Right. Right.
And there's a lot of that in society. If you can afford great care, you're good to go. If you can't, you sort of take your chances as
Exactly.
that it becomes a warehouse situation. Is that something you agree with?
Yeah, as any time in your encounters with the healthcare system in America, if you're rich, you can get great healthcare, the best in the world. If you're poor, you can get emergency care or whatever care society feels comfortable, diverting your way. And so for most of these patients, this is a publicly funded nursing home. Most of these patients have not had access to the American healthcare system throughout their entire lives. They haven't had access to a primary care physician or specialty care. And so many of them come into the facility debilitated by this inadequacy of our healthcare system. And then they find that society has said that they really don't value either the poor or the elderly, and they especially don't value the elder poor and those with dementia. And so what you end up with is sharing space with someone else, beds that are perhaps 3 feet apart, maybe 4. And sometimes you're sharing a room with 3 people, which is where our virus started. And so those recommendations from the CDC to social distance, to isolate yourself from others, to spend more time outside where the spread of the virus is attenuated. We do not give our elder poor the right to do that. We do not give them the ability or the permission to social isolate and quarantine. We insist that they're going to be in these warehouses. And so as this virus is done, it's uncovered a lot of inequalities in people younger than my patients in the United States healthcare system, in the educational system, with all the debate about folks staying home and kids from poor families not having the same advantage and access to internet and the ability to educate themselves at home. Same thing goes for our elder poor. We just don't care about them in this country. It's quite evident when you walk into a nursing home that's subsist on publicly funded dollars. So I'm a member of a group of physicians that makes it their livelihood to spend all their times in facilities. And we've always known, people like me, we've always known that this is a situation that's ripe for disaster, especially with an infectious disease. And we deal with that all the time on a much lower level. But with coronavirus, it really fulfilled our worst fears. And it was, I'm not the only one that had to deal with this, because there's a lot of nursing homes like Canterbury out there. So it really fulfilled our worst nightmares. Yeah, I hope that the only way that this will come out okay in my mind, not that it ever will be okay, but the only way that it can be better, or there can be some sense made out of this, is if we actually do something about the way we treat our elders.
What brought you to this specialty, Jim? What brought you to this your professional station in life?
Funny. Yeah, not many people, going to med school getting excited about going into nursing homes and spending their career doing that. So I was a family practitioner, and in my career, my early career and training, I was all about kids and expectant mothers. I wanted to do OB and deliver babies, what we call full breadth family practice, procedures, all the exciting stuff, or what I thought was the exciting stuff. And so I ended up, my first job was in basically a retirement community in the Northern Neck, Kilmarnock, where there was, a very high, the average age there is much higher than the rest of Virginia. And so I ended up discovering that older people were not only, fascinating for what they've lived through and what they've seen and their wisdom, but they're also much more fascinating medically wise. Kids have a lot of sore throats and earaches, and you can only do so many of those before you start wishing for a little bit more medically interesting, phenomenon and diseases. And so old folks gave me that. And then I left my practice to go to seminary. And that really clinched it, where the only way I could make money, the only way I could see patients, I couldn't come up with a practice and pay for staff. So I decided that going into nursing homes full time was the best thing for me. The staff was there, patients were there. If I had a change in schedule semester to semester, I'd still be able to have an office, in the facility. And I discovered doing that, that was a novel idea to me, doing nursing home full time. It's not something anybody else in Kilmarnock was doing. We all did nursing home, before and after our real office hours. So it was kind of a pain before that, but doing it full time was when I really discovered I loved the atmosphere. It seems weird. It's most people kind of get depressed when they go into a nursing home, but if you spend enough time in there, you realize that this is a place where people form community. It's not a place where people, the people in there don't go there to die. We see that from the outside. We kind of predict that if we were in there, what will we do? Well, we just kind of curl up and die. But people that are in there, they're still growing. They're still living. They're still forming relationships and community. And you discover that. And it was a great, life-changing discovery for me when I started doing nursing home work full time. So it was kind of my twisted route into a full-time nursing home. And I never was interested in going back to family practice after that. I still find it, even after all of this, tremendously appealing and of course challenging. And on every level, medically, there's nothing more complicated than a nursing home patient. But also just the things these people have been through, just to hear their stories. We've got World War II vets still, of course, Korean and Vietnam, folks that have lived through the Depression, all the stories that they can tell, people that are, I've got a patient I'm going to see today that's 102 years old. it widens your horizons. And then, the final thing that really gets me charged with nursing home work is, again, I'm probably, for a lot of these people, the first primary care doctor they've had. And so we get to, kind of cover a lot of ground. We get to go back and talk about what their chronic diseases are like, and they discover that there's still room for chronic disease management that can actually make them feel better. And we meet regularly, and it's a way to reassure them that society has not forgotten them. That someone, not just me, but all the people that work there, we value them. Even though you walk in and you see a picture of a neglected, area of society with our dingy walls and, linoleum and fluorescent lights, the people in there remind our residents that you're still loved, you're still cared for, and we see you as a valuable human being. So I really get, that drives me as well. So all of that together just makes it, I can't tell you how fulfilling this job is, really.
Yeah, I was just thinking about the stark juxtaposition between, and maybe not completely dissimilar, but pediatrician seeing a kid grow up, come up through grade school into middle school, and seeing some events go on within the family's lives as they have a medical relationship with this kid or the family. And then the other side of that, you and people and physicians like you who are with these folks, these elderly folks, in the twilight of their lives, but as you said, still continuing to evolve and a desire to be vital. And I imagine the relationships, of course it's professional, but the relationships, emotional attachments that you develop and that they develop with you must be pretty darn strong.
Yeah, they are. Yep. Which is why it made it, those 3 months were really, really hard.
Well, it's awesome that as we transition that you want to do something about it, and your vision for Homecoming, the Memory Village, is modeled after something that's going on in Europe. Can you talk to that a little bit and explain Homecoming?
Yeah. So Homecoming, which is my vision, it's homecomingrva.com is where people can take an actual look at our vision. I had heard about a place in Amsterdam. It's called Hoogevik or Hogevik. And it's the first memory village for folks with dementia in the world. It was a redesigned nursing home, and they thought they could do a better job than what they were doing. They kind of felt they were warehousing elders as well and just kind of waiting for them to die and sticking them inside, not letting them go out. So what this does, it forms a secure area that people with dementia can wander, can have the freedom to wander. And there's, of course, indoor space where people live in neighborhoods, maybe 12 to 14 people in a neighborhood. And they have unfettered access during 6 a.m. to 10 p.m., unfettered access to an outdoor space. And the outdoor space is a town square. It's got a fountain, it's got a cafe where they can sit and have a coffee or a beer or a wine, and then a market. So they can go and shop for the day's food. And then they bring it back to their neighborhood. People get together and help fix dinner. And it, recreates a real life, a world as it is for these folks, instead of just a room, right? Because that's what we provide for folks with dementia now. It's a living space, but not really a place to live. And so they designed this. I think it's been in existence maybe 10 to 15 years maybe. And then other people have copied it around the world, but for some reason, it's never been recreated in the United States. Some of that has to do with financing. The governments in most European countries put a lot more money into elder care. The United States doesn't. So any kind of project like this is going to be funded with private dollars, not government dollars. So it's a little bit, less sure bet. The closest one that we have is in British Columbia, in Vancouver, and that just opened up about a year ago. So we're planning on being the first memory village in the United States. I'm assembling a team of administrators, healthcare professionals, financiers, and we're looking at actually property right now. And I want a place in the Richmond area that fulfills a few different criteria. It has to be on a well-traveled artery, and it has to be close to a population center. It has to have mature woods, and it has to have a stream. Because my goal is, as opposed to the Hoogvik concept, it's an urban concept. What I'd like to do is even go further with the outdoor space. I do want a town square, with a cafe and a market and a fountain. But what I want more than that is the ability for my residents to wander. I want them to get back into nature and find a place that's far away from the facility. I want them to get to a place where they can't even see the facility. And so in a secure area, I want them to be able to wander through woods again, hear the wind going through the trees, and see the stream and hear that going, and really feel like they've escaped. Because I find in my work with folks with dementia, they very rightly feel that they've been imprisoned, because once you go into a facility, if you have dementia, you can just forget about outdoor space. You can forget about animals. You can forget about plants. What you're going into is a very sterile, controlled environment. And if you agitate too much to try to get outside, you get medicated. And I do it. I'm not blaming doctors or facilities for doing that. It's really just the way it is. I mean, if you put a 65-year-old man with advanced dementia into a locked facility and tell him he can't go outside ever again, he's going to get angry, and he's going to get sometimes violent. And so we end up medicating people quite a bit. And so watching this over my 25 years of practice, I've wondered what would happen if you simply open the doors. If you open the doors, you let them wander, you let them do what they want to do, which is to, get out. And so our principle is based on a few things, but the number one principle for me is unfettered access to substantial outdoor space. And so here in Virginia, we can do that. We can find, especially around Richmond, you can travel 15 minutes out of any kind of dense urban area and get into the country. So we're looking at places in Powhatan and Goochland right now that fulfill that criteria.
You mentioned, just as an example, 65-year-old man with advanced dementia. What would be, say, the limit of dementia advancement for someone to be a candidate for attending a village like that?
Yeah, really, I don't think we're going to put any lower or upper limit on it. Due to finances, we are probably going to start with an assisted living. Now, assisted living, functionally, you do have to be able to, for example, get in and out of a chair by yourself with only, one person standing by. You can't be, two people can't have to lift you. So it'll be for mobile people to begin with, thus the outdoor space. My dream and my goal is to have a long-term care facility that will be on the campus as well. So when we build, we'll build to long-term care code specifications so that we can expand. But just as far as finances go, we'll start with assisted living, and the reason that is quick primer on healthcare. When you're over 65, you get Medicare. Medicare pays for acute stuff. It pays for hospitalizations. It pays for rehab for up to 90 days after hospitalizations, but it does not pay for long-term care. In order to pay for long-term care, you either pay out of pocket in this country, or you spend down all your resources and then get Medicaid. And in Virginia, Medicaid pays some of the lowest rates in the country. And so it's very difficult to imagine something like this subsisting on the small rate that Virginia pays for long-term care. So we'll have to find some way to finance our long-term care section through private dollars, assisted living, most likely. And here, the thing that prevents us from being easily replicated elsewhere is, and the reason why you see a lot of facilities going up that look like condos, just one room stacked on top of each other, is that outdoor space is unfinanced space. It's not making any money. These trees in the stream, that's not paying the bills. So most facilities are focused around making sure that all that space is being financed by either private or public funds. So as far as who will let in first, it will be those more mobile people. But as far as what is your stage of dementia, you can be very advanced in dementia, meaning you have ability forming words, you have, you're incontinent, you need a little help with eating. You can be in that stage of dementia and still qualify for assisted living because the mobility parts of your brain are separate from the memory parts of your brain and the speech parts of your brain. So you can still be very, very mobile and be very far along in dementia. And I have a medical directorship at a assisted living that's strictly for folks with dementia. It's on the south side. It's called the Memory Center. And we have gentlemen in there that are very robust, very mobile, very strong, but can't understand language, can maybe eat by themselves if they're prompted. So it's an long answer to your question. It is it really will come down not to your level of dementia. It'll come down to your mobility and whether you qualify legally for assisted living status. Once you get past that, needing to be transferred from bed to chair with full assistance, then you're into a long-term care kind of situation.
From a layman's view, that being me, the benefits of a place like this just seem absolutely exponential. And while you were talking there, it made me think that, exercise, health, access to the outdoors have been proven to help cognitive ability, if not cognitive, at least clarity.
Yeah,
that seems to be an added benefit. You mentioned that you'd like to have it big enough where the patients who are going for a walk or something along the streams or out near the woods or in the woods wouldn't even be able to see the facility. Let's say there's someone who is a little bit more advanced and becomes confused a little, far out from the facility. Will there be, say, markers or directional?
So we're going to have to use some creative landscape architecture to really get this nailed down. I see wide paths that have lights that would lead to and from the facility. Our original concept included a bell tower that would be visible from any part of the campus. And we may still do that. Building codes kind of get in the way for bell towers oftentimes. But I would like to have a piece of architecture that's visible. And then what we also will have is a shelter in the woods. So we'll have a retreat where someone, if they're confused, they'll have access to shelter, and an indoor space that can protect them from the elements. But we'll also have people. So our groundskeepers will be, much more important than in the typical nursing home, of course. So those folks are going to be out there keeping an eye on things, helping to engage our residents in activities. And speaking of which, the other benefit of outdoor space is that you have things to do. You have vocation. You have real things you can contribute towards the community. So, anytime there's trees, there's always branches to pick up, there's always leaves to rake, there's always grass to mow. And so we'll have our residents participating in the life of the community, not just playing bingo.
And that reminds me of what you were talking about with the square. It sounds like you could have a little performance space.
Yeah, exactly.
And
Yep.
people may not know you're quite the musician yourself. I can see you out there
So
busking.
I hope to play in the, yeah, exactly. I'll put my guitar case out, see what I got.
That's right.
But yeah. So, right, having music there. We've even talked about a music festival on the grounds. So part of our three principles, I haven't talked about our three principles. One is unfettered access to substantial outdoor space. The next is community reintegration. And so instead of the usual warehousing, ghettoizing of our elders, where they go into this dim, dark place and never come out, we want to make it a place where the community would come into. So part of that is having, yes, a performance space, where we would have musicians go, but even having a once-a-year music fest on the grounds. I would love to have that part of a fundraiser. We're going to be a nonprofit. Part of the fundraiser, things for our facility will be a once-a-year music festival. And then we're going to have retail space on the grounds as well that the community would want to go to. So either a coffee shop or a brewery, someplace where people would linger. Most people would not be caught dead on a memory campus, but we're going to have people want to come and hang out. A dog park and a daycare, not only for our workers, but also for the surrounding community. So thus reintroducing children into the campus as well. So yeah, music should be a big part. It's a big part of people's lives. Before they start living with dementia, it should be throughout their whole lifespan. So we're going to make sure that that's there.
Wow, that's amazing. The music, another built-in benefit. You see so many things on programs like 60 Minutes and stuff where someone with advanced dementia has a moment where they start playing the piano again, or something from their youth.
Yeah,
makes them light up after no response for so long. That's incredible, man.
Yeah, it's amazing. I mean, the thing about dementia is that it affects recent memory, and what it really does is affect the brain's ability to capture recent occurrences and store them in the brain. So you'll forget conversations. You won't be able to remember something. You're learning. Your ability to learn really takes a dive, but it only affects the long-term memory stored in the brain at the end. So even advanced dementia, you still have nuggets of memory that you can access, maybe not always, but you can access on a good day. And so that's why you see folks that sometimes may have trouble forming a sentence can sit down at a piano and play, a Mozart piece. So yes, I think pianos should be scattered around the facility, guitars, and all of that stuff.
You mentioned that you've, had quite a bit of support around the idea. Mm-hmm. I'm sure you probably can't mention any names, but have you had support and indications from, say, business leaders, politicians to mm-hmm. sort of give you the feeling that this is actually going to happen?
I can't say that, so that's the big thing. We just need to raise about $25 million. So, at this point, what I'm doing is forming my team and doing some pro forma analysis. So once we have a good financial model in place, and fortunately I have people that know how to do that on my team, then we're going out for fundraising. And actually I'm planning on our initial pitch in September, early September. We're talking to a group, and we're hoping that that's when we'll find out whether the interest that we have translates into funding. I think I've spoken during the COVID crisis. I've spoken with all of our representatives, our federal and state representatives, more about the horrible shape of elder care rather than my vision for the future. And it resonates, just the fact that, we warehouse our elders and the result is a very high mortality rate amongst the oldest old. It resonates, and not just because they're politicians, but because they're human beings. So I'm hoping that an alternative to that is going to resonate with them as well. And the where politicians would get involved is that it can be very difficult to build a nursing home. You actually have to purchase nursing home beds, and they're very expensive. And I don't mean beds, I mean the ability to have people in a nursing home. It can be very expensive. And I think, lobbyists quite frequently favor larger groups that want to hold on to their advantage in the marketplace and not make new nursing home beds available. So it's a very daunting task. And so that's where I'm hoping I can get government agencies and politicians involved to help us be the first memory village in the United States, because it's going to take, it's what Richmond is going to do. We'll see. That's what I want to find out over the next year. What can Richmond do to help us make this a reality? And once it is a reality, it's going to be a Richmond thing. We're going to be proud of it. So I will be talking to those people, and we'll see. But my guess is, it's resonated with everyone I've talked to. It's going to resonate with business leaders and people that can make it, grease the wheels of legislation and make it happen more easily.
Wow. Well, however you want to refer to it, silver lining, or for every action, there's an equal and opposite reaction. However you look at it, it would be amazing if something good could come out of this recent experience. And Homecoming RVA just sounds absolutely incredible. I would urge people to go to homecomingrva.com and learn all about it. Hopefully support it, get on board. I appreciate your time today, Jim. I'm hoping you'll come back from time to time to give us some updates.
Of course, I'll show you some pictures.
Okay.
Invite you to the groundbreaking, all of that good stuff.
That'd be great. And I'd love to get in on that music festival. Bring my silly band along, and
please do.
Or maybe even sit in with you again.
Yep, that would be great.
Well, cool, man.
Always welcome.
Jim Wright, I really appreciate your time. Best of luck, and you are doing amazing work, man. I appreciate you making some time for the Good Eye Podcast.
Appreciate you having me on here, Jay. Really do. Thanks.
Thanks again to Jim for his time and insights and expertise on the tragic happenings at Canterbury Rehabilitation and Healthcare Center. Now, I do find it just a little bit ironic that despite the tragedy that went on at Canterbury, that he has had this idea for Homecoming in the Memory Care Village for quite a while. So he is quite a spokesman for the issue, and I want to thank him again for his time and his input today. I do urge you to go check out what's going on with Homecoming. He mentioned it a number of times. You can find it on the Good Eye Podcast website. That's goodeyepodcast.com. Also, Apple Podcasts, Spotify, Google Podcasts, pretty much anywhere you get podcasts, you can link there directly, or just go to homecomingrva.com. And feel free to contact me directly, jay@jsmack.com, or goodeyepodcast@gmail.com for any reasons, especially if you have guest ideas or topic ideas, or you would like to bring something to light, or if you would like to come on and share your views on a topic. Feel free. Open minds, open discussion here. And we always strive, that's the goal anyway, for intellectual honesty. So you'll always get a fair shake. Thanks very much for listening. And until next time, try to look at life with your good eye.